Hello, my name is Ebony and I'll be a student nurse and I'll be doing your lung and thorax assessment. Can you tell me your name and date of birth, please? Okay, thank you. I'll begin by checking the posterior area and I will first inspect the scapula to make sure that it is symmetrical, flat, and equal and everything is appropriate. I will then check the breathing to make sure that no accessory muscles are used and the patient breathing is relaxed and comfortable. Next, I will palpate the posterior area to make sure that the patient reports no tenderness and reports no unusual sensations. Then I will palpate the region to make sure that it is free of lesions, masses, and rashes. Then I will check the firmament and I will instruct the patient to say 99 every time I touch the back with the other side of my hand. The vibrations are symmetrical and they are noted in every location. Then I will check the patient's chest expansion and I will find the T9 area and I will place my thumbs there and I will instruct the patient to exhale and inhale and then I will watch my thumbs rise and fall, which is an appropriate finding. Next, I will percuss the back area. I should hear resonance over the lung tissue and I should hear dullness around the diaphragm. Next, I will check my diaphragmatic excursion, and how I do that, I will instruct my patient to exhale and tell them to hold it, and then I will percuss downward until I hear dullness, and then I will mark that place with an X, and then I will tell my patient to inhale, and I will keep on percussing downward until I hear dullness again. The normal finding is 3 to 5 centimeters, but it could be 7 or 8 depending on whether my patient is an athlete or not. My patient finding is 4, which is an appropriate finding. Next, I will auscultate. The bronchial region is first. The bronchial vascular region is second, and then the vascular region is at the base. I did not hear any adventition sounds, which is appropriate. Next, I will auscultate again, but this time I'll tell my patient to say E. The sound is muffled and faint, which is an inappropriate finding. Next, I will go to the anterior region, and I will check. I'll make sure that there is no barrel chesting noted, and I'll make sure that the AP diameter is 1 to 2, which is appropriate. I will then check. I will look at the sternum to make sure that the sternum is midline and straight with no deviations. Then I will check my patient ribs to make sure that the ribs are symmetrical and the ribs are at a 45-degree angle, which is appropriate. Then I will check my patient respiration. The rate is 18, which is appropriate. They are symmetrical, unlabored, and with the appropriate depth. The patient breathing has no retractions, which also is an appropriate finding. And there are no accessory muscles being used to breathe. Okay, next I will palpate the area and make sure that there are no tenderness or any unusual sensations. Then I will check the area, make sure there are no lesions, no masses, and no rashes. Then I will check my patient's firmament again, and I will tell them to say 99. The vibrations or symmetrical and located in, well, and noted in all locations. Okay, then I will find the xiphoid process and place my thumbs around it, and then I will tell my patient to inhale and exhale, and then I will watch my thumb rise and fall to check for equal chest expansion. Then I will percuss again. I should hear resonance over my over her lung tissue, and I should hear dullness over the breast tissue. So everything was appropriate. And then I will auscultate the area. As stated already, the bronchial region is first. The bronchiovascular region is below that, and the vascular region is at the base. No adventition sounds were noted, which is appropriate. And then I will auscultate again, but this time tell my patient to say E. The sounds were muffled and faint, which is appropriate finding. And that will conclude my assessment.